Hi everyone, I'd like to welcome you to the Specialty Nursing Info session. My name is Julie Alley. I'd like to put a couple of reminders out there to please be on mute and that everyone will receive the slide deck and a link to the recording next week. Before we get started, the British Columbia Institute of Technology acknowledges that our campuses are located on the unceded traditional territories of the Coast Salish nations of the Squamish, Tsleil-Waututh, and Musqueam. Now, I'd like to pass it over to Kathy Kennedy, who is the Associate Dean of Specialty Nursing at BCIT.
Great. Thank you so much, Julie. Yes, as Julie said, I'm the Associate Dean for Specialty Nursing, and I welcome you here today. We're going to be presenting on a few of our programs, not all of them, but you can see on the slide before you that we have several specialty nursing programs, and very happy to speak to you about any of them. And you can certainly reach out to the program heads in any of those areas if we don't cover that program or that topic with you today. All right, and you're going to hear today about how specialty nursing, we offer our programs to diploma RNs looking to earn their BSN in nursing. We have alternate pathways for LPNs to study in a few of our specialized areas, which we'll talk about today. And all of our programs do lend towards credits into the UVic Master's program. So once you have an advanced certificate in specialty nursing, you will be granted some compensation towards your credits in the UVic Master's program, which is fantastic. A great relationship we have with both. So our specialty nursing programs, as you know, are designed for nurses who are already interested in working in specialty areas. And we have nurses who have a couple of different specialty advanced certificates sometimes, and not just one, but we're here for you if you want to learn a little bit more about our programs. On to the next slide. So there's two different ways that nurses move through our specialty programs. We have part-time delivery studies, which we now call flexible learning, and you can take our courses at your own pace, course by course, and you have up to 7 years to complete the advanced certificate. And if you did go course by course in the program rather than doing it all at once, it would range in programs. So usually it can take up to 2 years to complete the specialty. And then we also have a compressed time frame delivery, which is usually arranged through sponsorship from your health authorities or your employer. The majority of our learners do come through this way, and it takes place in a very condensed time frame. So typically you do your prerequisite courses over a distance, and then you would be coming into what we call our CTF model. So it's full-time, on campus, online, in the clinical environments, and so it's done in a much quicker and condensed format. Thanks, Julie. Next slide. A lot of people have questions about our clinical practicums, and so we always try to make sure that we arrange them within a hospital within your region that's close for you, so we wouldn't want to be putting you somewhere very far away from where you live. We do have multiple sites that we access across the Lower Mainland and across the province and on the island. We have shift work can be expected, and some of the clinicals are instructor-led clinicals, and other ones are done in a preceptorship model, depending on which programs that you're looking for and which course that you're looking for. And then it would be the responsibility of our learners to find their own transportation to the sites, and not usually accommodation. Usually it's close by where you live, but if required, that responsibility be on the learner. So who is this for? Certainly, as I mentioned in the beginning, it's nurses in Canada who are working or looking to move into a nursing specialty area. We also have, as mentioned, the diploma RN seeking to complete their BSN or an advanced certificate. The LPN programs that I mentioned at the beginning are in particular offered in the perioperative area and the nephrology area. Sometimes we have learners, our undergraduate learners, that are taking some of our courses during their for that elective portion of their nursing program, and we of late have developed what's called learning pathways, and there's opportunities to complete some of these elective courses as you continue to move through your degree. And I did mention about the nursing program. Thank you, Julie. Next slide. So here's your outline for our website if you want to click on there. We're not going to be speaking about every single one of our programs today, but we're definitely going to be hitting some highlights. So if you're interested in learning more about specialty nursing, about our entrance requirements or any specific programs, please feel free to get this information down. And we are more than happy, and any of the program heads or our program assistants are happy to speak with you if you have specific questions or you want to know if this is the right area for you or how you can move through our programs. They're more than happy to answer those questions. Perfect. So I think I'm going to turn you over to Jan Morrison. So she's our program head for a post-diploma BSN completion program. And over to you, Jan.
Well, thanks, Kathy. So who is this for? If you're a diploma prepared RN and you want to move up to a Bachelor of Science in Nursing with specialty certification, have I got a deal for you? Our program is designed to do just that. So most students will start out completing the specialty certificate proportion, which is up to 27 credits, and then move on to the academic portion of the degree, which is another 33 credits for a total of 60 credits. This is kind of a graphic that really illustrates it very well. So you would move through our specialty certificates, you go on to the BSN pathway, and then you graduate with not only a Bachelor of Science in Nursing, but also a specialty certification. And I believe that we are unique in Canada offering this pathway. So a lot of diploma prepared nurses find that they're hampered in advancing their careers because they need a BSN to move into teaching or leadership or community health positions. And so this degree is what you are looking for. There's a fairly straightforward application process. You just need to collect your documents, transcripts, go online, submit your application. And generally speaking, admissions turns those applications around pretty quickly. So you should hear back in short order. And then you can begin your program. You can take the courses, as I mentioned before, in any order that you wish. And all of the academic courses are offered every term. So I think that's it. Yeah. If you have any questions, don't hesitate to contact me. I'm more than happy to talk about the program. Thanks very much, Julie.
Hi, everyone. So I'm the next program head to introduce the perioperative program. And perioperative is just another term for operating room. So next slide, please, Julie. So what is perioperative nursing? So for those that are unfamiliar, perioperative nursing ensures safe care and provide patient care for those that require surgery. And just on the slide, there's a list of a few examples of surgeries that you may have heard of or even experienced yourself. So there's a huge range. So we go from ortho surgeries like knee scope, knee replacement, gynae surgeries like cesarean sections, and also general surgeries such as gallbladder removal and also appendix removal. So those are just a short list of the amount of surgeries that are available and that we do. And one of the most rewarding parts about being a perioperative nurse at the end of the day is just to be able to help fix a problem and ultimately give the patient a better opportunity for a quality of life. And then so many people may assume that perioperative nursing doesn't really involve direct patient care, but in reality they do. It just looks different. So perioperative nurses support patients receiving surgery through two main roles, and they're called the scrub nurse role and also the circulating nurse role. The scrub nurse role is often portrayed on TV that you've probably seen as part of the sterile team. So they're all gowned up in the blue gowns and they're kind of amidst the action, assisting with the surgeon. So in reality, they do assist the surgeon by preparing the equipment and also supplies, and they work very closely also to the circulating nurse, as they are a very restricted kind of in their as sterile team members. On the other hand, you have the circulating nurse role. And they're the ones that you usually see checking patients in, setting them up for surgery, and they help monitor and ensure the needs of the patient and also the rest of the surgical team. And similar to when you're taking off on an airplane, the circulating nurse just makes sure everyone's on the same page and ready to go before the surgery commences. Now, both roles provide patient care and advocate for patients, especially this being one of their most vulnerable times. Most of the time when you're in surgery, you're under general anesthesia or conscious sedation. So perioperative nurses are essentially the patient's like eyes and mouth, right? So speak for them and watch for kind of safety issues for them during that time. One of the challenges that you may see with perioperative nursing is gathering pertinent information, especially during check-in, because our check-in window is quite small. Like within 5 minutes, you're trying to build a nurse-patient relationship and that trusting relationship in that short amount of time. And so who is this for? Like Kathy mentioned earlier, we offer in perioperative program, we offer 3 pathways. So one of them is for RNs and BSNs who would like to work in the OR and also obtain an advanced certificate in the perioperative specialty nursing. We also offer it for LPNs who would like to also work in the operating room. And it's a very similar format to how we deliver the pathways similar to the RNs and BSN. And we also have a special pathway for perinatal nurses. And these are nurses who work on the maternity unit. And oftentimes the unit has their own surgical team that does primarily C-sections. So we prepare the nurses and expand their scope of practice to be part of the C-section team. And then to be successful in our program, I would like just to mention a few attributes that may be helpful to have. So some of the things that we've seen is having a strong interpersonal skills and excellent organizational skills. You might say a lot of the perioperative nurses are a little bit OCD, but I think that may be similar to a lot of other specialties that you may hear of. You also have to have the ability to work very closely with your surgeons and also anesthesiologists and a lot of people in the room. So good communication skills is very important, and also being proactive. Also energy. I know that in the OR, it's like you're standing for a long time, so you do have to have a good physical stamina. All right, and then just on the slide here, you're going to see that this is what our program looks like. It's basically 25 credits in total with 3 theory courses in blue and 3 clinical courses in the pink. The first theory course is just a foundation overview, and then followed by the second theory course, 7250 or 7251. That's the scrub nurse role. And that's usually followed by a clinical, which is all about the scrub in 7350. And then you go back to the circulating nurse role, which is in 7450 and 7451. And then again, followed by a circulating nurse clinical rotation. And then the very last clinical, 7750, is the consolidation of both scrub and circulating nurse role. So that's kind of our 25 credits in a nutshell. And our theory courses are all available and delivered online, so distance learning. And then our perinatal program that I spoke of earlier, that's a modified pathway, so it's only 10 credits. And then so our graduates of the program are able to work with patients ranging from infants to elderly. As you know, surgeries happen to can occur in all ages. You're able to work in rural or tertiary care units. So it can be in the hospital. It can also be in private surgical centers. And there's also opportunities for the perioperative nurse to expand their roles as RNFA. So that's the first assist. They are usually helping with their in surgery, helping with a surgeon in a more expanded role. All right, and we also have a little video for you from one of our past students, and it's about 1 minute video, and she's going to share with you her experience of the program.
So I completed the BCIT perioperative specialty nursing program in 2020, and what I liked about the program was that it was offered in a very organized way, where we did the clinical portion at the hospital and the theory portion at home through online learning. And before we went on to do our clinicals, we had a chance to practice and apply what we've learned in sim labs, and this was done in a small group setting, so we were able to receive immediate feedback on what we did well on and what we could improve on. And all the instructors were very engaging and knowledgeable throughout the whole program, and also shared with us some of their own real-life experiences as OR nurses. And I feel that this very well prepared us for clinicals. And overall, BCIT program provided plenty of time and resources for me to learn all the appropriate skills and basic knowledge prior to starting my career as an OR nurse.
Perfect. And just on this next slide is just a few other students, past students that we had, and what they have said about the program and their experiences with perioperative nursing. So I'll just give you a few minutes to look over that. And just like Julie said, you will be receiving the slide deck and this presentation, so you guys can always review what they said afterwards. And the next slide, please. I'll just, we have our contact information, so you can reach out to me through phone or email, and also the program assistant, Stephanie Strong, and that's her phone number and email as well. Thanks, everyone. And I'll just pass it on over to our next speaker, Sarayda.
Thank you, Cindy. Hi, everyone. My name is Sarayda Ramazini. I'm the program head for the Emergency and the Pediatric Emergency Nursing Specialty Program. Matt will be speaking more to the Pediatric Emergency Program in just a little bit. So what is emergency nursing? It's a specialized area that has an energetic environment, is unpredictable, where quick decisions are made that positively influence patients' lives. So who would this be for? So next slide. Two different students that this would be for. So RNs looking for emergency certification, who are also completing their specialty BSN in emergency, who are completing their specialty BSN in emergency, and undergraduate nursing students currently completing an accredited BSN program, and they are able to take up to the first 2 courses of our program. Now, some characteristics that are important for ER nursing. So strong detailed assessment skills. Attention to detail is very important. Our patients don't walk in through the doors with a diagnosis. We essentially act as detectives, trying to figure out what's going on through our assessment skills. And we identify these red flags, which are the clues to figure out what's going on with them and how to best treat them. You also have to have a curious mind. So one thing I really like about ER nursing is the opportunity to learn something new every shift. You'll never know everything. Being curious and always wanting to know why is essential for this area. Making order out of chaos. The ER environment is very fast-paced and chaotic at times. So being able to really slow down, taking a deep step back and looking around and thinking about your priorities and who your patient is. This is very vital as things can change from one minute to the next. Being proactive. So this is essential because planning ahead and being able to anticipate your patient's needs is key. Falling behind and then you start to run into trouble and then you're more reactionary. This really is not good. So being able to really plan out and think ahead of your steps is really necessary for ER nursing. And also knowledgeable, so strong pathophysiology foundation. Our theory courses and clinical experiences are patho heavy. Our curriculum is designed to introduce foundational concepts early in the theory courses and then continue to build on those concepts throughout the remaining theory courses and clinical experiences. So if this is something that interests you and you have some of these characteristics and would love to work in a dynamic, fast-paced environment, emergency nursing may be for you. So the emergency nursing program has been around for over 35 years. Over the years, we've learned what nurses require to be successful and safe working in the very vibrant environment of the ER. Our approach is very learner-centered. We recognize all nurses have a tremendous amount of knowledge and experience. Our approach is collaborative, utilizing a lot of different tools and resources to really meet our students where they're at in their learning. The program is a blend of comprehensive curriculum of both nursing theory in emergency and clinical practice. The core courses provide the necessary pathophysiology, assessment framework, and nursing theory to allow nurses the opportunity to care for a diverse range of illness and injury from a wide age spectrum. Our program consists of 6 courses, 4 theory, and 2 clinical experiences for a total of 24 credits. And we run 2 different models. We run the distance, which is more of a slower pace over a 12-week term. It's using the guided learning models and as well as telephone and Zoom tutor support. If you work full-time, you would register for 1 theory course per term, although this can vary depending on your additional commitments. And also we do the compressed time frame. If you're interested in taking this more in a compressed time period, please reach out and let us know. So these are some of the things that students have said. I'll just leave this up for a couple of seconds. Right. And then for those nurses with shared interest in both emergency and critical care nursing, BCIT also offers a combined program. Please feel free to reach out to myself or Maya if you have any questions down the line, and we look forward to hearing from you. Thank you. Over to Matt.
Thanks, Rita. Thanks so much. Hey, everybody. My name is Matt Thacker. I'm the lead faculty for the Pediatric Emergency Program, and I'm excited to share a little bit more info about what we do. Thanks, Julie. So who is the Pediatric Emergency Program for? I think here at BCIT, we kind of have we promote it as basically anybody who has a passion for children and working with children as a nurse. Obviously, we really appreciate the context being in an emergency setting, but especially so, it doesn't need to be a specialized emergency setting. You don't need to work at BC Children's or at Surrey Memorial for this to be applicable for you. As we all know, children will show up at any emergency department in BC. So if you feel like you want to increase your knowledge and skills working with children in emergency departments, if you want to increase your knowledge and skills with acutely ill children as well, and maybe you don't work in an emergency department, this would also be beneficial to you, because we look at a lot of different presentations and how to manage kids when they get sick. So don't think when you hear pediatric emergency specialty that you have to only work with kids. You're going to work with kids in any emergency department and in many different settings across BC. So it's really, really important that if you feel like that would be an area to improve on, that we're for you. You can be a registered nurse and practicing. We also have pathways for undergraduate nurses to start taking some of our electives and some of our courses before they actually enter the workforce. So what do we do in the Peds Emerge program? What are some of the things that you can expect? So obviously we know children are very different than adults. You're going to learn how to kind of manage many different presentations as well as many different ages. I mean, if anyone has children, has worked with children, you know, a 2-month-old and a 4-month-old are totally different beings. So we're going to prepare you to manage the child kind of across that continuum, and to kind of give you, I mean, we say this lots during the program, but give you tools in your tool belt to kind of address, assess, intervene, and kind of manage these really sick kids. So there's tons of presentations on that continuum, and we really build on concepts. We start, introductory, kind of introducing you to emergency nursing, introducing you to the pediatric patient, and then we build nicely on that as well, going all the way up to kind of trauma management and trauma interventions for the child. So again, we don't just push you into the deep end, we set you up nicely, and we kind of build on concepts as we move through the program. And I think one of the things that we've really emphasized in our program, and again, if anybody has even tried to approach a child and talk to them, that communication is a big part of what we do as pediatric emergency nurses. So we focus a lot of the program on that. How can you approach a child as a nurse and make sure that your assessment is successful? How can you communicate with the family? Family-centered care is a huge part of pediatric nursing. So really making sure that we have that understanding and that knowledge. But in building on that, not only communicating with the family and the patient, but communicating with the team in the emergency. It's very dynamic work environment. You're going to work with many different professionals with many different fields. So how do we communicate, systematically and kind of advocate for our patients? Because as we know, children are very vulnerable. They're some of the most vulnerable patients you'll see in the hospital setting, especially in emergency. So how do we as nurses empower our families and our patients? And how do we advocate for them in their times of need? So communication is a big focus for us. And this is through lots of feedback from nurses who, are kind of uncomfortable dealing with kids. The first thing we always say is, I don't know how to approach them. I don't really know how to communicate with them. That's kind of a scary thought to me. So we really give you those tools in your toolkit to feel confident when you approach kids and when you approach families that you're going to care for them, following best practice standards and things like that. So what is our program? So some of the highlights that we want to mention, like some of the other programs that you've heard from already, we're the only one in Canada that talks about pediatric emergency specifically. So we're very proud of that. And we're also very proud that it's recognized across Canada as a specialty, as a certification. This is different than some of the other education out there, some of the other training that you might see, where it may not be recognized as formal education, but that's not the case for us. It is widely recognized across Canada. So if you end up moving or working in a different department, you'll still get credit. You'll still get that acknowledgement that you've had the certification. So that's really, really important for us. We do have multiple different methods of delivering our content as well. The distance course method can be taken across Canada and the world, really. It's a distance, very asynchronous type of model, and you can work on it at your own pace. We have 2 prerequisite courses and 3 theory courses. So as you work on them at your own pace, it takes probably about 2.5 years, because each course takes about 3 months as you kind of tick your way through it. And we offer about 144-hour clinical experience on top of that. And we work with you to make sure that that clinical experience is exactly what you want it to be. We have great relationships with many hospitals across Canada, and you get a really, really amazing experience no matter where you are in the country, which is amazing. If you are closer to home in BC and the Lower Mainland, you can come to us in the compressed time frame. It'll take just over 3 months, and you come to us from wherever you're working, and you get a kind of crash course of all the information over that 3 months, and you get the 2 prerequisites on your own time. And then that 3 months, you finish those 3 theory courses and the clinical component, and you'll finish that at both BC Children's Hospital and Surrey Pediatric Emergency. So again, great kind of diversity in the patient populations, the acuities that you're going to see, the people that you're going to work with, and we're really proud to kind of have that relationship with them. So two different models, and again, kind of touching on what I said earlier, if you are an undergraduate, we do have a model where you can start ticking away some of those prerequisites while you're in your BSN, so that once you're finished, you can come to us and kind of finish the rest of the course off. So if that's something that interests you as well, you can also reach out for that. So many different options, many different ways to kind of increase your PEDS emergent knowledge. And yeah, I think we're going to have a video now for one of our past students.
So thanks, Kyle, for coming out today. I know it's super busy in today's world, but I appreciate you taking a couple minutes here to speak to the program. So if you'd like to maybe just say hi and introduce yourself.
Perfect. Hi, my name's Kyle, and I previously worked in the emergency department at Children's Hospital. And currently I am a coordinator with the Vancouver pediatric team and a clinic nurse with Insight.
Great. Yeah. Well, thanks for coming, Kyle. Thanks for sharing all of your insight. So, thinking back, you took our program a couple of years ago now. So just thinking back to that time when you joined, why did you decide to, take the leap and join the program, and what did you envision for yourself?
Yeah, the emergency department is one of those places where you get to be the jack of all trades, master of none. And it's a controlled chaos, and it's a perfect mix for getting a lot of things accomplished, but it doesn't really give you that opportunity to take a deep dive and to really understand and hone certain skills. So what I was really looking forward to with the program was the opportunity to consolidate my knowledge and my practice, and to get into that simulation world and prepare for those one in a million cases that PEDS is known for.
Yeah, I'm so glad you spoke to that, because that's a huge advantage of taking the time in these programs, right? Is to the ability to be a student again, and to be vulnerable and to learn all these things that we may not, especially in emergency, you know, have the time to actually understand some of the things that we're seeing, because it's quite chaotic. So I appreciate you saying that. That's amazing. Yeah. So reflecting on your time at BCIT, what did you like about the program? What did you value in it? You know, reflecting on those 3 months.
Reflecting back on it, I really valued my time with the instructors. I felt coming into this experience, in some ways, I felt like a nursing student all over again, but then working with my instructors and and the clinical instructors, it was as if we were peers and we were all learning together, which was a great environment to be in. The other piece that I really valued was the simulation, the amount of simulation practice, the equipment that was accessible to us. I felt that I could directly see from before I started the program to after my confidence in the critical care setting, and just being able to navigate what should be happening, how to advocate for clients, and just the communication level that should be there.
Yeah, I couldn't agree more. The team we have in our little program is quite amazing, and you know, not only the experience that our instructors have, but also I think, you know, the networking as well. You know, pediatric emergency can sometimes be a little bit of its own little world. So you know, that networking, you know, learning from people, you know, so experienced and so knowledgeable, it definitely puts a perspective on everything. And I mean, branching off of that as well is that simulation staff that we have as well, and the experiences the work that they put into, you know, for us as faculty and for you guys as students is quite amazing. And that's great. Well, thanks, Kyle. So the last little bit I would love you to speak to is, you know, again, reflecting back, you know, before you're entering the program and as you were moving through it, is where did you envision yourself, you know, where did you envision yourself going with nursing, and where did you think it was going to take you?
Yeah. My big plan was either education or leadership. And one of the other pieces that allured me to the program was the frameworks and the processes that would help with teaching and supporting new staff and preceptors and in the emergency department. And yeah, just kind of looking at different master's programs for leadership and policy type things.
Great, yeah, and that's why I was really excited to have you come and speak, because, you know, now working in a pediatric public health lens, you know, it just goes to show that the skills you learn, you know, in a pediatric emergency program can be, you know, extrapolated and threaded through any sort of either emergency or pediatric care that you kind of venture off into, and so that's amazing. Great.
Yeah.
Well, thanks, Kyle. Yeah, I appreciate you. I appreciate you coming, and I appreciate you taking the time out. And we'll see you around.
Sounds good. Thank you very much.
All right, thanks, Kyle.
Thanks, team. Thanks, Julie. And thanks, Kyle. It's always great. So yeah, if you have any questions about the pediatric emergency program or pediatrics or anything in general, feel free to shoot me an email, reach out. My email's on the screen, as well as mine as our program assistant. Would love to hear from you. And now I'm thinking I'm throwing it over to Jean. Yes, there we go. Thanks, Jean.
Thanks, Matt. Hello, everyone. My name is Jean DeHaan, and I am the current program head for high acuity specialty nursing. For those who are unfamiliar with high acuity specialty, in true teacher fashion, let me begin with a definition. So high acuity nursing practice lives between the regular medical surgical units with patients admitted with acute illness and the intensive care unit that admits patients requiring life support. So in high acuity, nurses closely monitor patients to manage their complex acute illness and or identify a worsening illness status so we can address these changes early and use advanced interventions that may not usually be available on medical surgical units. Next slide, please. So there are a wide variety of learners who enroll into the high acuity specialty nursing program. We have BSN students who take our first foundational theory course, followed by our virtual clinical course. We have RNs with a nursing diploma who complete our advanced specialty certificate and use it to obtain their Bachelor of Science in Nursing via the BCIT post-diploma BSN program. And this was discussed earlier in our presentation by both Kathy Kennedy and Jan Morrison. We also have RNs that already have their BSN degree, but who are advancing their nursing knowledge and their skill set to work on these specialized high acuity units. So high acuity nursing is becoming, I would say, more and more relevant on general medical and surgical units. The patients on these units are sicker today than they were maybe even 10 years ago. And honestly, I anticipate that patient acuity will continue to increase over time, as it has over the last several decades. What high acuity specialty nursing education will afford you is a way to revolutionize your nursing practice, to care for patients with complex acute illness that have concurrent multiple health challenges. Currently, BCIT offers the only high acuity certification program in Canada, and the program has received accreditation by the Canadian Nursing Association. The high acuity program is offered in two ways. The first is a part-time option, which takes on average about 2 years by distance education. So that would be one course per term for you to complete at your pace. The second is a compressed timeframe option, which completes in 19 weeks, which is equivalent to about 2 terms. So you can decide how slowly or how quickly you want to complete the program. That said, I invite you to contact me directly to discuss options in our course offerings to accommodate both your personal and professional needs. Coming up next is a video testimonial from one of our recent graduates, Catherine Duncan.
Hi there, my name is Catherine, and I recently completed the Advanced High Acuity Certificate at BCIT. I completed this specialty nursing program as part of the training for the Burns Trauma and High Acuity Unit at Vancouver General Hospital. I applied to a high acuity unit after around a year on med-surg because I was ready for a challenge in my career and a fast-paced environment where I would have the opportunity to think critically and advocate for very sick and complex patients. Because of the nature and complexity of caring for high acuity patients, I'm very grateful to have the additional training under my belt. I can speak directly to how the high, of course, a motorcycle. Okay. Okay. Hi there, my name is Catherine, and I recently completed the Advanced High Acuity Certificate at BCIT. I completed this specialty nursing program as part of the training for the Burns Trauma and High Acuity Unit at Vancouver General Hospital. I applied to a high acuity unit after around a year on med-surg because I was ready for a challenge and a fast-paced environment where I would have the opportunity to think critically and advocate for very sick and complex patients. Because of the nature and complexity of caring for high acuity patients, I'm very grateful to have the additional training under my belt. I can speak directly to how the high acuity program at BCIT equips nurses with the knowledge and clinical exposure they need to succeed in high acuity environments. What do I love about the program and career? One of my favorite things about the program was how relevant I found the material to my everyday practice. For example, in my current role, at the start of every shift, one of the first things I do before report is print out a cardiac rhythm strip for my monitored patients. The dysrhythmia interpretation and management component of this program gave me the confidence to interpret a wide variety of cardiac rhythms and readily identify concerning findings. The theory taught throughout the program was supported by case studies and clinical anecdotes from the instructors and my peers that brought the material to life. The instructors were great at not just telling us how things work and why, but also explaining why we need to know this and how it applies to our future patient populations. The oxygen supply and demand framework that serves as the center of the high acuity theory courses is incredibly useful. From the framework, I've developed a shift in my understanding, and this allows me to consider end organ perfusion in my patients in a way I never had before and anticipate worst case scenarios. Several different opportunities for simulations throughout the program allowed us to apply our learning, think critically, make mistakes, and grow as nurses in a safe environment, which allowed us to build our confidence for clinical. The clinical placement gave me a solid foundation coming into my unit orientation. I was given sufficient exposure to a wide variety of patients to meet my learning goals. I appreciated clinical debriefs where the students and instructor had the opportunity to learn from each other and discuss our learning in a collegial, judgment-free environment. My clinical instructors were fantastic, patient, and provided useful, constructive feedback. It was great to have the opportunity to learn from their experience and integrate some of their clinical pearls into my practice moving forward. My favorite thing about the nursing profession is the privilege of caring for people on their worst days and supporting them and advocating for them throughout the challenges of illness and hospitalization. In addition, it is very rewarding to bring the nursing perspective as a valued member of a well-functioning interprofessional team. I think nurses bring care, compassion, and humanity to life in all of the work we do, and I'm proud to be a part of that. Where do I see myself professionally in 5 years? One of my favorite things about my current unit is that with the variety and complexity of patients that we see, I feel like there are always so many new things to learn. I will continue to seek out environments where I'm challenged and can further develop my critical thinking. I hope to expand my knowledge by continuing to seek out additional certifications and education. For example, just 6 months after completing the high acuity program, I just recently obtained my ACLS certification, which was recommended to me by both of my clinical instructors. I learned from the codes I've attended in person and from the ACLS course that I'm very interested in resuscitation and the incredible teamwork and knowledge needed to keep someone alive. I plan on pursuing additional training in critical care and eventually completing a master's in nursing to further research and education in the nursing field. I also see myself as a clinical instructor with the hopes of eventually becoming a faculty and teaching the next generation of nurses. I feel very grateful to have had the opportunity to complete the BCIT High Acuity Specialty Nursing Program, and I highly recommend it for students looking for a challenging, highly rewarding specialty where their assessment makes all the difference. Whatever you choose to pursue, I wish you the best of luck in the nursing field, and I look forward to maybe working together in the future. Thank you. Take care.
Yes, thank you so much. So if you would like more information about high acuity specialty nursing, please feel free to email me or our program assistant, Stephanie Wood, and we can answer any questions for you. Thank you so much for your time, and we really look forward to hearing from you. Thanks.
And now we'd like to open up the floor to our Q&A portion. If anybody has any questions, please feel free to kick yourself off mute or post your questions or comments in the chat. While we wait for that, I'm just going to put it out to the next slide, which is our social media handles and our links to visiting the website and upcoming info sessions, as well as program advising. It looks like all of our questions may have been answered during the presentation. Now, with that, feel free still to post in the chat, but while we wait for that, I'd like to thank all of the program heads that came and presented today, as well as Kathy Kennedy and Erno Jerry for her technical support during this session. With that, I wish you all a wonderful sunny afternoon. I'll stay on the meeting for another 5 minutes. Oh,
there's a question from Brady regarding the approximate cost of the critical care program.
Yeah, I was just typing that out, but I'm happy to answer.
I wasn't sure if you saw my tag yet.
I did. Thanks, Alicia. I would suggest, Brady, just to reach out to Luda or Jenna, and they can go over the costs with you. So it depends if you're doing it as a sponsored student, then of course that's paid by your employer. And then if you're looking at doing it as an independent learner, just paying for yourself course by course, they can go over the cost structure for that. It is all online as well if you want to take a peek.
thank you for that, Kathy. I think we may have answered all the questions in our chat. Yeah, we have. Okay, so with that, thank you to all the program heads. Kathy, and Aaron for attending, and everybody that took the time to attend this session. You will receive an email next week with a link to the slide deck, all the videos, and the presentation. Thank you. Have a great afternoon.